Good afternoon, everyone. Thank you for being here. No new deaths since yesterday. Good news. 205 of our neighbors we've lost directly related to COVID during the pandemic. Looking at testing, again, we started to talk about this a little bit. The way we do testing in our community is starting to transition. Not as many diagnostic tests now that we have a more affordable saliva test. Many of the tests happening in the community that when they partner with us are saliva-based, and also with the universities and colleges are saliva-based. So we'll give you diagnostic test numbers, we'll give you saliva test numbers, and then overall positive rates based off of those tests. Since yesterday, we've received back 1,179 diagnostic tests. Our 7-day rolling average for diagnostic testing is 0.76%. Again, the state website and our data are different. Ours is essentially real-time data. Often we'll get positive cases that need to be transitioned to another county. Certainly that impacts the number on the state website, so our information is more accurate. In addition to diagnostic tests, Syracuse University has performed over 27,600 saliva tests since August. None of this has been in that data point. We've also tested now over 2,460 local school district staff as part of our back-to-school testing program. And over the last 7 days between Syracuse University and our testing program, we've done over 5,200 saliva pool tests. From the pooled saliva tests in the last 7 days, we've had 2 positives, both at Syracuse University. And when you combine our nasal, diagnostic, and pooled tests, so all the tests in the community, our 7-day average drops to 0.51%. Looking at hospital numbers, 13 individuals in the hospital, nobody in the ICU, so that's very good news. Out of the 13 individuals, 9 are Caucasian, 3 African American, and 1 of another race. Looking at cases, we now have 3,872 positive cases since March 16th. That is 4 new cases, so good day. 4 new cases. Again, that's one of the lower numbers we've seen. Out of the 4, 1 household contact, 1 travel related to the state of Arizona, 1 from a senior living facility, and 1 community spread. So again, a great community spread number there. We currently have 171 active cases, down 2 from yesterday, and we have had 3,501 of our neighbors recover from COVID-19, up 6 from yesterday. Looking at who's been impacted by COVID, 2,220 females, 1,652 males, 350 under 19, 797 in their 20s, 514 in their 30s, 458 in their 40s, 575 in their 50s, 430 in their 60s, 310 in their 70s, 277 in their 80s, and 161 in their 90s. Related to back-to-school testing, so far no positive cases out of the 2,460 tests. That's very good news when you think about that's what we want. We don't want any positives going back into school, but we're doing this to try to find that case, that hitting asymptomatic individual. Today we have been doing testing at both Liverpool and at MBT Bank Stadium for Syracuse City School District employees, as well as Liverpool High School employees out at Wetzel Road. Tomorrow we will be doing back-to-school testing for any district employee that has missed it, and any student as well that wants to go get tested tomorrow at MBT Bank Stadium. Good way to go get a test. So certainly we're excited about this. Again, I want to thank all of our partners in this process. Not many people in the state are doing this. So again, we take going back to school very seriously, and very, very happy with the program to date. we received a small cleanup sales tax payment in today. That sales tax payment was off 8.14%. It was a July cleanup period, so 8.14 off of our budgetary number, a smaller payment, but again, still going in the wrong direction, although 8.14 is better than some of the other payments we've received. So it's starting to go a little bit in the right direction, but certainly the reality is we have a hole, and the decisions we have to make have to be made. And so, saying that, we were very happy to reach a furlough agreement with the CSEA, our largest bargaining unit. The agreement is multiple parts. Let me go through what this is. A voluntary furlough for individuals who choose to take it for a minimum of 1 week. This is based off of individuals who may have child care, family care issues, and those with concerns of returning to work full-time due to health concerns. This is approved by the department on our ability to accommodate the requests, but this is essentially a voluntary furlough for employees who have child care issues or health-related issues. It needs to be a minimum of 1 week. That's voluntary. The second component is an involuntary furlough, a compulsory furlough, and that would go from the period of 9/12 until March 31st of 2021. The third part of this is we've reopened the voluntary retirement option that we gave earlier this year through next Tuesday. So staff members that qualified that didn't take advantage of the early retirement incentive now have the opportunity to take advantage of that. Furloughs certainly are at management's discretion. Furloughed employees may be eligible for unemployment based off of eligibility requirements that are not controlled by the county. Furloughed employees can maintain health and dental benefits. Certainly they're still required to continue to pay the employee contribution during the period of the furlough. And we will be offering the same terms to our management confidential employees as well. So this is a tool that will help us avoid some layoffs for sure, but layoffs are still part of the equation, although we will certainly wait to see what kind of participation we receive from our voluntary furlough to see what is necessary. Saying that, happy to take questions.
A voluntary 1 week furlough, and then for the non-voluntary, what does that mean?
Yeah, so there's a minimum. If you want to take a voluntary furlough, Josh, if say for example during your children are in a hybrid schedule that doesn't work with your work schedule, and you wanted to, it costs you more money for child care than to come to work. You wanted to take a furlough. We'll allow that, but it has to be a minimum of 1 week. We can't furlough 3-4 days, right? It could be a lot longer than 1 week. That's a voluntary furlough. So we'll take from the voluntary furlough list, see what we get, and then that will help impact the decision. The second piece is an involuntary furlough. Instead of laying off employees, we would furlough employees up until March 31st of 2021. And then the third component is we have a retirement option back on the table through next Tuesday. So there were many individuals who qualified for the retirement incentive. Remember, we offered that before the pandemic, and probably didn't take it. Maybe things have changed, and they want to take that. And so we may have already even had a couple employees take that option.
So how many involuntary furloughs are you planning?
Depends on how many voluntary we get, Tim. So we'll wait and see over the next week or so to see what we get. But we're going to, our strategy of cost savings for the first, I'd say the next 3-4 weeks is still the same. So we still have certain cost savings we have to meet. If we can do that through furlough rather than layoff, we will. But then we get more data in October, and that may trigger more moves that we have to make.
So it's not that each compulsory furlough is that entire period from September 12th, which is, what, Saturday? They don't all begin then?
Correct.
And
Correct.
they don't all necessarily go 6 months?
They don't necessarily have to. They can be called back at any time. But this gives us the same flexibility in the same period of time that the legislature gave us for workforce hours reductions.
Are you going to use furloughs mostly in place of layoffs then?
We will certainly try to use furloughs first where we can. And if we don't get enough participation, we then need to make assessments as to what you would use a furlough first if you wanted to bring that service back in 2021. If the service is going to go away or be limited, then you would look at layoffs more.
How much participation ideally would be for you guys?
We're going to need participation to avoid a compulsory furlough and a layoff. So if we don't get a lot of voluntary participation, a lot of people in this boat, we might get more than we think in this boat, right, with some of these schedules for school. But certainly if we don't, then essentially what we're doing is instead of having a certain number of layoffs, we'll work in furloughs into as many positions as we can.
For this entire 6-month period, all dependent
Yeah,
on a lot of variables?
Yeah, there's a lot of variables, right? This isn't, I don't want to be here talking about this. We've already become the leanest county government in the history of the county through this pandemic. But the reality is this is what we have to do. We have to balance a budget in 2020, and we need to put forward a budget in 2021 as well. So if there are some variables that can change, sales tax can get drastically better. I don't think it will get drastically better. I think it will still be bad. I just don't think it will be as bad. We may, in October, get an October surprise with a stimulus deal that helps us. I don't have a lot of faith in that, but that could happen.
Is $6 million still the rough target to
Yep.
meet for savings for the end of the year?
It is. Today's data didn't push that the wrong way. It kind of came in on forecast. So certainly that's the number we think we have to meet in 2020. Other questions?
For the school students who might want to get tested tomorrow, if they're under 18, do they need to be accompanied by an adult, or how does that work?
I believe yes. The answer is yes, as Dan Weirs is shaking his head at me. So there's a reason we have Dan around.
Aside from the pooled tests that you've done of school employees so far, do you know of any local schools where there have been positive cases, where teachers or others are in quarantine now?
We're tracking those, so we don't as of yet, but we are tracking those. So specifically, that's something that I'm being briefed on, just like I am with university students. We'll certainly be watching that, and there's nobody at this point.
There's nobody yet.
Correct.
Ryan, for somebody watching this that might want to go to that mass testing tomorrow, can you kind of just walk us through what they can expect?
Yeah, so right now, if you wanted to get an appointment, you could go to our health department website and register. Certainly, if you don't, we'll still test you, and then you would come and you would give your information, and then certainly right now I believe we're still doing the saliva-based and diagnostic test, and so then you would essentially get your test. You'd go probably within 24 or 36 hours, get a result, and so right now we really encourage the young people to do it. We're going to do more testing with high school students. We're going to come out probably next week with our overall plan with testing during the school year. We've been working a lot with our health department and upstate on what that's going to look like. And so it's going to be a comprehensive, well thought out plan, but certainly we know there's been pockets of the virus in younger people. 20-year-olds certainly leading the charge. 30-year-olds, almost our second largest demographic behind the 50-year-olds. And then certainly when you look at our under 19, these are more 17, 18, and 19-year-olds. So the virus has found the way into these networks. So these young people don't get sick and as well as much as other people, and so a lot of these folks are asymptomatic, and so we got to find them. So we encourage folks to get your young people tested. Saw some pictures on the internet of young people in some gatherings too. That certainly we need to remember. No gatherings of over 50. I didn't count out the people, so I don't think they're quite at 50. But certainly mask wearing, still need to do these things just because everything's gotten better. And we're really hunting, for asymptomatic cases to prevent problems in our buildings, in our facilities. We need to still do what works. And distancing, mask wearing, if you're going to be within 6 feet, still is the rule.
What's been the feedback from teachers as we've been testing them the last week and a half or so?
Yeah, look, we put it out there. We knew this was a concern from a lot of teachers, and so we put it out there. Certainly, hopefully we'll get robust participation today and tomorrow. Some districts have had better participation than others, but again, we'll probably have over 3,000 tests that were done for faculty. Not sure what percentage of the overall eligible faculty that is, if it's 40, 45, 50. But we heard you. We took care of a way to get you tested to help deal with the concern. And so far, no positives. So I think overall, the program's worked, and it especially works if we find that one or two asymptomatic individuals and make sure that they don't go back to work before they're deemed ready by the health department.
Just on the furloughs, is it fair to say that this agreement with the union now will delay your decisions about layoffs, or are there certain services you're going to cut and those layoffs are coming soon?
We're certainly looking right now. Our phase one is going to go to operations that can be deemed seasonal, or operations that just haven't been up and running at full capacity due to the pandemic. So those decisions were probably layoff heavy. Now will probably be furlough heavy. So, but voluntary furloughs could potentially impact various departments. So we want to see what those look like first. But we're still going to move, and we have to move because we have a dollar amount we have to save. Probably late next week.
Months ago, we entered phase 4. Since then, we've had a couple updates from the state. Has the state given you any indication on an end game here as far as getting back to where we are? I know a vaccine is important, but have these announcements, whether it be gyms or casinos, come as just as much a surprise to you as everyone else about the timing of them?
Yeah, I think at this point there's so few industries left that the ones that are being left, there's not a data point driving this decision-making process. This is really a decision being made by the governor's by the governor and health department, whoever his advisors are. I wish there was a data point that under 1% for this many days, your arcades are open. You can go and increase your gatherings from 50 to 75. You can move your banquet facility. Events can increase. We've put forward and are putting forward a proposal related to hospitality to try to get something in front of the state to make them move a little bit. Certainly, we think we need to. I know the state's concern was colleges coming back, spikes. What does that do? Certainly, there's examples of spikes in certain communities, not in ours, and not in our region. So we've gone through that, right? Travel was going to make us hit the roof. College is going to make us hit the roof. Hasn't happened. Now back to school is a concern. I get it. That's why we're doing what we're doing. Same thing we do with colleges, we're doing with schools. so that all the legitimate concerns they can point to why some of these industries are still in a half percentage mode with restaurants and things, that once that deck is clear, that what else are we waiting for? Open up the valve a little bit more. So we're working through that. I know those were some of the state's concerns, with college, what's going to happen. We've kind of weathered that phase one of that. We still need to be diligent, but we're doing it. And then back to school. The challenge with back to school is back to school in some districts, your larger districts, aren't really back to school. So how much longer are we punitive on some of these industries? So I think this is kind of a balance that we need to find again related to restart.
With the evolving technology for testing, where it's probably sounds like it's going to go more and more to pooled testing as a surveillance technique. Is that going to change the state's metric that you have to meet on diagnostic tests? Is that a discussion that you're?
Yeah, we're having it. I think they have to move, and I think now that you have different types of tests, I think as long as everybody and I know the state agrees with the saliva pool test, they've given their seal of approval. I think the test is a test now, and we should be incorporating the saliva pool test into the data on the New York Forward page. I think that's been my message. Hopefully we can get there, because it really underscores, not just in our region where we are, but really the whole state, because many of upstate's now doing testing for every SUNY campus. So a lot of these small communities now have very robust testing going on with the students, but the students go out into the community, and so as well. So if the virus was active in that community, you would see it reflected in the students as well. So I think overall, hopefully the state will start taking in all this testing being done by upstate into their numbers, and then we get more accurate numbers on where they are. Because in our community, we're not going to, when we have a test that's as accurate as a diagnostic test, and it costs $100 less per test, that's what we're going to do. So the diagnostic percentages to me aren't worth anything anymore if the most affordable and accurate test is now being administered in our own county.
Well, also, I wonder if you think it would be smart now to start reserving these more expensive PCR tests just for outbreaks or symptomatic
Correct.
people, and not using them up sort of blindly for universal testing.
Yeah, from a supply chain standpoint, I would agree with that. That plan, prepare, use these, in your supply chain, in your reserves when you need them. And I know we have quite a few diagnostic tests in our reserves if necessary. Getting them processed is expensive still. And everything's changed a little bit too to that point with insurance was covering these tests for a long period of time. Now they're not. So they only cover the symptomatic or direct contacts. So we got to evolve as the rules evolve. And we've done that the whole time. We're finding our new balance now with testing. And the numbers are great. And if we continue to do the right things, the numbers will continue to be really, really good. Other questions? Okay. Well, thank you very much, everybody. We will see you next week then.
Monday?
Monday.